Atherosclerosis. When atherosclerosis occurs in the coronary arteries, it's called coronary heart disease, coronary artery disease, or coronary vascular disease. The center one, coronary artery disease, seems to be the term in favor right now, but you'll hear them called all three. Atherosclerosis involves lipid deposits on the inner lining of the arteries. Lipids are a form of lipoproteins. They are a combination of triglycerides, cholesterol, and proteins. Now, when we hear about lipoproteins, we hear about the LDLs and the HDLs. We have VLDLs, which are very low-density lipoproteins, and LDLs, which are low-density lipoproteins, and these are generally regarded as the bad lipoproteins, or the bad cholesterols. The HDLs, high-density lipoproteins, are considered the good cholesterol, and they are responsible for recycling cholesterol through and out of the body. Atherosclerosis, there's injury to the vessel lining. Quite often it's caused by hypertension, smoking, or different environmental exposures. The low-density lipoprotein filters into the lining of the artery and becomes trapped there. The LDL is trapped in the injury. It then becomes oxidized and engulfed by macrophages, and they produce foam cells. The foam cells accumulate, combine with additional lipids, and form fatty streaks inside the blood vessels. And these in turn become fibrous plaques. Now these plaques accumulate and continue to expand, and they may even occlude the artery, cause a blockage, or break off and become an emboli, travel to some other part of the body and cause a blockage. The risk of coronary artery disease in patients with cholesterol levels of 300 milligrams per deciliter is 3 to 4 times greater than those who have levels less than 200 milligrams per deciliter. Risk factors. Well, age is one of the big ones. Males 45 years or older and females 55 years or older, or women with premature menopause who are not on estrogen replacement therapy. They're all at risk for coronary artery disease. Also, family history plays into it. History of premature coronary heart disease, coronary artery disease. And here's our friend tobacco again. A current cigarette smoker is much more likely to get coronary artery disease. Hypertension greatly increases the risk because it's going to damage the blood vessels and start this cascade towards the plaque formation. Low HDLs, because we don't have the protective factor if they're low. And diabetes is associated with vascular damage, so it again will start the cascade toward plaque formation. The protective factor is high HDL, good cholesterol. We want it to be 60 milligrams per deciliter or higher. Treatment, diet and exercise are the first things that we try. If they don't work or don't work enough, then we add the anti-lipemic drugs, the anti-cholesterol drugs. But diet and exercise are the first line of treatment.